The 16th branch of MegaMart and MacroMart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. MegaMart and MacroMart, your favorite shopping destination.
Hello everyone, good evening. Welcome to yet another episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle. I am Jasila Mujib. In this talk show, we bring before you an expert doctor from Al Hilal Hospital to discuss your various health issues, to guide you in your journey towards good health. As parents, we are always concerned about the diet of our children. Today the topic of discussion is common nutritional issues in children. We are delighted to have with us Dr. Pragyee Dhingra from Al Hilal Hospital, Muharraq. She is a specialist in pediatrics and she is also a certified child nutritionist. So to discuss the topic in detail, let's move on to the doctor. Doctor, thank you for being with us today and welcome to the show.
It's my pleasure to be here. Thank you for inviting me here.
It's our pleasure also. So doctor, usually parents complain that their child is always a picky eater. What's your observation on this and what's your guidance to the parents?
Picky eater is very common thing what we are seeing today, especially in the age group of 2 to 5 years. Normally the child will come, the child is having not interest in the food, or child will be having particular food. I want to have only this meat, I want to have this fish only in the food, I don't want to have any other food. Or sometimes they will be having, today they will be demanding a food, tomorrow no, I don't want this food. This is very common. 6 to 50% of children are having this problem. So the American people, the American Academy of Pediatrics, they have issued some guidelines how to help them. First is share the meal together. Normally what we have, first the child will have the food, later we'll have the food. That is a wrong practice. If the child is having sees us having the food, the child will be more comfortable. Oh, my parents are having the food, let me also try this food. Second, do not bribe the child. Normally we tell, you have this food, I'll give you a chocolate. This is a negative association. This is not a healthy association. Child will always be having, okay, let me finish this food. He'll be just having, he'll not enjoy the food. This is just like a practice for him. Let me have the food, I'll get a chocolate. Third is try. If the child is not accepting now, try in another form. Suppose the child is not accepting any fruit. Then you can put in the form of a custard. You can give in a cut of a fruit cream. So child may like that in the form. Fourth is, let the child decide how much he wants. We can provide the food, but we cannot force the food. If you are forcing the food, Now, this may again lead to a diabetes in future, obesity in the future, or it may have a negative impact. The child may feel, no, this food I'm not liking the meal time. The child will have the aversion for that food. Fifth is offer variety. If you are giving the same food, same flavor to the child every day, even we are bored with the food, so we cannot complain for the child why the child is not having. Offer him a variety. Every day, every meal, there should be around 4 different colors of the food for the child. So these foods are rich in antioxidant and child will be happy. Sixth is plan the meal together. Suppose your child is going to the school. So you can ask a night before, what food you prefer in the morning. So, or you can incorporate, come, we'll prepare the food together. Like this, child will be more excited. It may be just stirring of the food or serving on the table. The child will be, I have helped the mother. He'll have more happily. Seventh is, once child accepts the food, a particular type of food, then you can introduce similar type of the taste. Like suppose your child is having a cauliflower now, then you can introduce broccoli. It's a similar taste but different variety. And finally, when you're feeding a child, start with the unfamiliar food first, then give the familiar food. Suppose child is liking a meat a lot and he does not like vegetable. If you give just the meat, child will reject, no, I don't want the vegetables now. So start with the vegetable, then slowly go toward the meat. These are some points you can try to have for the picky eaters food. Child.
These days we find that children often fall sick. So what food items would you suggest to boost their immunity?
There are many common food what we have daily which help in immunity boosting, like yogurt. Yogurt is very rich in many of the food like calcium, vitamin D, vitamin K, and it boosts the immunity also. So you can incorporate as a buttermilk, as simply curd, or you can put some vegetables like beetroot and give it to the child. Second is citrus food. We give tomato to the child daily, but we don't know how much useful it is. So you can give tomato as a curry, as a fruit. You can give oranges, you can give lemon, you can give lemon water. This is rich in vitamin C, vitamin K, phosphorus, magnesium and antioxidants. Then cruciferous fruit like broccoli, cauliflower, cabbages, which is rich in vitamin A, C, K, iron, calcium and vitamin K. Lean meat and fishes you can give to the child. Berries, strawberries. Now lots of seasons will come for the berries you can give to them. Seeds like sunflower, flax seeds you can give. Oats, eggs, turmeric. This all food is known to have rich in immunity and is known for ages. This is not recent studies, this is ages. This will help the child to incur any viral illnesses there or any infections are there to help them feel better.
So we have to incorporate all the colorful vegetables, fruits.
Yes.
Okay. So doctor, some children always complain, I don't have appetite, I am not hungry.
Yes.
So what food would you suggest to increase their appetite?
This is a very common thing what we see in our practice. There may be many causes. First you have to rule out why the child is not hungry. Is it because of iron deficiency child is not feeling hungry, or there is any viral illness? If the child is having fever, even if when we are having fever we do not feel hungry. Or there is a teething, especially in the infants, toddlers, the teeth are new teeth are coming, child may not feel hungry. Or there are any ulcers in the mouth, or it may be throat pain. First rule out these things are present. If all things are not there, then we may think, okay, the child is not hungry because there may be deficiency in the food. You can give ginger for the child. It may be just in the food or in the lemon water. You can give fennel seeds. Same fennel seeds you can give with the food, or you can give along with in the diet. You can give in the curry. Then zinc rich food, mushroom, spinach, pumpkin seeds, beans, cashews. They are all rich in zinc. Zinc improves the immunity as well as their appetite. Then water. You can give water 30 minutes before the food. So this also increases the appetite. Pomegranate. Again you can give as a juice, fresh juice, or you can give plain as a pomegranate in a salad, or you can give in as a custard or something. And finally peanut butter. Peanut butter has lots of benefits. I will be discussing again in the future. You can give the peanut butter instead of giving the plain butter to the child.
So these are the foods that will increase the
appetite. Yes.
Okay. Yes. Then as a parent, I would like to know how much sugar should I give my child?
Yes. Before coming to this question, I would just like to discuss there are two types of sugar. One is the free sugar, what we have in juices, in cakes, in chocolates, in sweets. That is not very good for the child. Second sugar is the binded sugar, what we have in the cow milk, in breast milk and in fruits. That is good for the child. So free sugar should be minimum, the binded sugar should be more. So it has more benefits.
You mean artificial and the natural?
Yes, yes.
Okay.
So the natural food sugar is very good for the child. There are some guidelines which has been given by the WHO. Less than 1 year, no sugar should be given to a child, no honey should be given to child. From the 1 year to the child is adult, the sugar should be only less than 10% of the total food diet. And the artificial sugar, what we call as stevia, should not be given to child in less than 3 years of age.
Okay.
I'll come to, according to age wise. If your child is between age 1 to 2 years, less than 1 year, no sugar at all. 1 to 2 years, the child should have only 1.5 tablespoon, 1.5 tablespoon of sugar. It can be like 1/4 of an ice cream, 1 small pack of M&M, or 2 pieces of chocolate, or 1/4 serving of a cake. That is the maximum in a day the child can have.
Okay.
Between the age 2 to 3 years, the child can have 2 tablespoons of sugar per day. So it can be 1/4 of the ice cream again, 1 pack of NMM, 2 pieces of chocolate, or 1/4 serving. So it should be very minimum for the small children.
Yeah.
4 to 6 years, the child can have around 2.5 tablespoons of sugar. It comes down around half ice cream in a day, 1 pack of NMM, half Snickers, the small Snickers come 57 gram, that half of it, half serving of cake. 7 to 9 years, the child can have around 3 tablespoons of sugar. It is around 3/4 of an ice cream, 3/4 of a Snicker, or 3/4 of a serving of the cake, one piece what we give to the child. From 10 to 12 years, it can be around 3.5 tablespoons of the sugar per day, around 1 ice cream or a 1 Snicker chocolate or 1 serving of cake. The high sugar, it can be associated with ADHD in the child, obesity, diabetes in future. So we are very much particular how much sugar we are giving to our child. It should not be, you can keep a chocolate box in front of the child, you take how much you want when you are hungry. That's a wrong practice. So it should be limited. It can be given in a reward if a child has done a good thing, but not as a free sugar. Every time of the day you cannot give to the child.
Okay, doctor. Now, doctor, can you explain the nutritional requirements like iron, calcium and protein requirement of the child as per age?
Okay. Normally the iron, calcium and requirement is different per age wise. If the child is between 7 to 12 months, the iron requirement is little higher because we require his organs to grow. Between age 1 to 3 years, around 1 to 7 to 12 months, it is around 11 milligram per day. Between 1 to 3 years, it is around 7 mg per day. 4 to 8 years, it is 10 mg per day. 9 to 13 years, it's 8 mg per day. Again, it comes down. For the teenage, especially for the girls, the iron requirement is more because once they start their cycles, there is a blood loss. We require to compensate that blood loss. So it's around 15 gram mg per day, and for the teenage boys, around 11 mg per day. I'll give some example of what food are rich in iron. So the parents can incorporate in the child's diet. Around, if you are a non-vegetarian, mutton liver, it's very rich in iron. So around 100 mg of mutton liver is around 10.3 mg. It's almost, if you give 100 mg iron, this around, I'm telling in approximately in a week, how much you can give. So it's it will take care of the iron requirement in a day of 1 day. 1 fist of cashew or almond, it is around 1.5 mg per cup. 1 serving of fortified infant oatmeal, it is around 5 mg. 3/4 cup of Cheerios, it's around 6 mg. So instead of giving them chips or French fries, you can give them Cheerios. Half cup of lentils, it is around 3 mg. Half cup of dried apricots, it's around 1.7 mg. 1/2 cup of oats is around 1.7 mg. 1 egg is around 1.4 mg, and half cup of raisin is around 1.5 mg. 2 teaspoon of peanut butter is around 0.6 mg. So all these food is rich in iron. You can give them in replacement of other artificial food. So this will help the child for growing better. It will reduce the irritability of the child. It will increase the iron anemia. Anemia will be better for the child. So this you can incorporate.
Okay, about the calcium?
Calcium, from less than 6 months, we around give 200 mg per day. Normally it is maintained by the mother's milk, breast milk or fortified milk what we are giving. It has sufficient calcium. But if the mother is diabetic, then the child calcium may go low. That time we need to supply with the baby with the calcium, otherwise not required. 6 months to 11 months, child require around 250 mg per day. 1 to 3 years, child around 700 mg per day. 4 to 8 years, child requires 1 gram per day. 8 years, it's around more than adult, 1.3 gram per day child requires. So I'll be sharing what food is rich in calcium, so the mother can incorporate. Like almonds, it has 230 mg per cup. Coconut, we do not know how much nutrition the coconut is. It is around 200 mg per cup. So 1 cup child is having coconut, child is having almost half of the requirement of the calcium. Lentils is around 180 mg per cup. Peanuts, walnuts, flax seeds, all the nuts, it's around 130 mg per cup. Broccoli, it's around 180 mg per cup. I know the taste of broccoli may be a little peculiar for the kids. What I do for my kid, I grate the broccoli and then I put the wheat flour and I put an atta for that. And I give the wheat flour chapati for the child. So it's a green chapati, child is happy, I'm happy.
Appearance,
yes,
appearance.
Yes. Then oranges, normally the child like oranges. It's around 40 mg per cup. The lady finger, it's around 170 mg per cup. You can prepare it even in the dal you can give, or if your child likes a plain vegetable you can give. Drumstick, we Indians have lots of drumstick in our diet. It's 400 mg per cup, it's the richest. Then sweet potato, instead of giving regular potato you can give sweet potato. It's around 78 mg per cup. Yogurt, it's around 400 mg per cup. It's very rich in calcium. Even the milk is around the similar, 300 mg per ml, per 100 glass. One glass is around 200 ml. So it's around 300 mg in 200 ml glass. Soya bean, it's around 175 mg per cup. Soya bean is rich in calcium as well as protein. So instead of giving normally if my child is asking for potato, tikkis and all, I put soya bean or paneer in that. So it's rich in protein, rich in calcium, child is happy with the taste, and it is very nutritious for the child also. Coming to the protein part, for protein for small kids, once we start the weaning, once the child starts eating, 7 months to 12 months, it's around 11 gram per day. For 1 to 3 years, it is 13 gram per day. 4 to 8 years, it is around 19 gram per day. 9 to 13 years, it's 13 gram per day. For adult child, like for above teenage child, we calculate normally according to their weight. Your child is around 50 kg per, we give 1 gram per kg, around 45 to 50 gram, the child requires protein per day. Okay. I'll just give an example what food are rich in protein. Normally vegetarian food does not have that much good quality of protein. They may have quantity, but quality is not that great. Suppose you are giving lentils for a child, you are a vegetarian person, you can give different variety of lentils every day. Do not give same lentil every day. Suppose today one masoor dal, next day you can give the green dal, next day you can give the yellow dal, everything kidney bean dal. You can give variety of dal. So there should not be deficiency of protein in the child diet. Otherwise you can give dry fruits, walnut, almond, these are very rich in protein, around 15 gram per 100 gram. Sunflower seeds is 20 gram per 100 gram. Black bean, soya bean, it's around 30 gram per 100 gram. So very rich in iron. Mushrooms, if a child like mushroom, 13 gram per 100 gram. You can give as a stir fried, you can give as a curry, whatever child is like. Oats, you can give oats as a, if your child, it depends on your child's taste. If he likes sugar, you can add with the milk and give some sugar, or some dates you can put if you do not want to put sugar, or you can put as a, with vegetable you can give, with salt and all you can give, whatever preference. It has 8 gram of protein per 100 grams, so very rich. Corn, sweet corns, both of them, around 3.5 gram. If you are a non-vegetarian, beef if you like, half of cup of beef is around 22 gram of protein. So it's very rich. Or chicken breast is also 26 gram in half cup. Yogurt, 1 cup is around 13 gram. Or milk, half glass of milk is around 8 gram. So full milk is around 16 gram. Very good source of protein. These all you can give.
And milk products also we can incorporate.
Yes, we can incorporate. Egg is very good source. We normally call egg is whole protein because it contains all nutritions. So 1 egg is around 6 gram. Fish you can give around half cup is around 19 gram. Again peanut butter, like I told, it increases the immunity, it increases the appetite, it's rich in calcium, also rich in protein. It's around 2 spoon is around 8 gram. So instead of putting butter, you can put the peanut butter for the child.
Okay, that is very informative.
Yes.
16th branch of MegaMart and MacroMart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. MegaMart and MacroMart, your favorite shopping destination.
So doctor, can you please describe the age-wise diet chart for children?
Yes, I'll describe, and if we can do, we can put a chart for the child also, so the mothers can note down. What we can see in a child, how much calorie the child is taking, how much protein, calcium, and how much iron child is taking. This is the main what we normally require. I'll tell you according to age wise. For a child less than in 6 months to 1 year, when the mother is started incorporating the weaning, that complementary when food is starting, initially the mother can start normally with the dal water or rice water. This is very rich in protein and child accepts fast. Then she can give mashed mashed potato, mashed banana she can give, mashed avocado she can give. She can give puri of the food because child does not have the swallowing reflexes till now. So whatever she can do, she can put in a grinder and she can give the vegetables. She can boil the vegetable, carrot and all, and she can put in the grinder. One thing what is more important for the child, she should not give any sugar or salt till 1 year of age. Okay, and no honey also. Honey can cause some allergic reactions. And after 1 year, she can, it is not recommended till 2 years, but she can put some salt for the taste. So the child accepts it well. Okay. And she can start with the egg yellow part. Egg white has more allergens. So when she is incorporating in the food, egg yellow should be started first. Then she can start the chicken, fish, not a problem for that. She can start the wheat after 11 months of the age. And from 1 year of age, she can start the cow milk. It should be full fat of the milk till 2 years of age. After 2 years, she can shift to the low fat milk. Apart from that, when the child is 1 year of age, the teething has started, she can start some fruits and vegetables. The daily requirement of water from 1 year to 2 years around 600 ml, like around half bottle the child should have. If she can take water, she can take as a soup, she can give. Then vegetable, she can give half cup of vegetable, mashed vegetables she can give because the 1 year old child may not swallow that well. Then she can give fruits like half cup of fruit. Example, half banana, avocado, 4 to 5 strawberries she can give in a day. Potato, rice, pasta, bread, sweet potato, whole grain, cereals, banana, oats, cornflakes. She can give aram. There is no restriction. She can give half a cup in a day. This is uncooked, I am telling. After cooking, it may swell more, so she can half cook. She can give in 3 to 4 times. The mother can give parts. Initially, the child may take only 2 to 3 spoons in at a time. Do not worry, no problem. Once she is prepared, she can keep it for 2 hours. After that, she has to discard the same food. And after that, you can again 3 part you can give major meal, 2 small snacks. Major meal may be just half chapati or some 5 or 6 spoons of rice. Pasta, whatever child preferences. And snacks may be 1 fruit, 1 or 2 strawberries the child can take. After 1 year, the maximum we can shift the focus on the foods that what the mother is preparing. Breast milk should be continued till 2 years, but maximum should be on the food what we are preparing because the breast milk may not be nutritious after 1 year of age. And she can give milk products around 300 ml per day. That's 1.5 glass she can give. Okay, and meat she can give 30 gram or 1 small piece in a day. Egg she can give 1 or 2 eggs per week. And fish she can also give 1 small piece twice in a week. And oil, butter, ghee she can give around 1 tablespoon or small teaspoon, 3 teaspoon maximum in a day. Like I discussed last time, the previous time, the sugar. Sugar should be given only around 1.5 tablespoon per day. That too if required. We will try to avoid that in the child. Okay, this is an average of a child can take. It's just not a fast rule. You have to give this much in a day. Just an average what she can try in a day.
Approximately?
Approximate, yes. Yes. Then coming to the age group 2 to 3 years. Child requires around 950 kilocalories per day. The iron requirement is 7 mg per day. The protein is 13 gram per day and calcium is 700 mg per day. Now she can increase the fluid from 500 ml to 700 ml per day. She can increase her vegetable to 2/3, vegetable and fruits both, to 2/3 cup a day. We were giving half cup for 1 to 2 years old. She can increase it. And the potato rice, what is rich in more of starch food, that which make the child more comfortable and satiety. It will make child full. That she can make to 2/3 cup a day. We were giving half cup for 1 to 2 years. Milk, she can give 350 ml. That's like more of 1.5, more than that. She can give. If the child is not taking in one time, she can give in parts. It's not necessary one time if the child may puke out, child may vomit it out. So she can give one time in the morning, one time in the evening, or if the child is not comfortable with taking the milk, she can give the paneer. Paneer, around 30 gram of paneer is equal to 100 ml milk, or she can give the cheese. That is around 15 gram. 100 ml of milk equal to 15 gram of cheese.
And yogurt also?
Yogurt also she can give, yes. Meat is around, again, one small piece per day she can give. Egg she can give 1 to 2 eggs per week, and fish one small piece 2 times a week. Oil you can give around 5 small spoons per day. That is also if necessary. Like too much oil, too much sugar, it leads to in future in the younger children diabetes, obesity. So oils are good for absorption, but sugars you have to avoid a little. Okay. This is again an average, and boys tend to eat more than the girls. This mother should remember, like she should not compare my boy child used to eat so much, my girl child is eating less, because normally girls eat lesser than the boy child. Okay. Coming to 4 to 6 years of child, that energy requirement will be 1250 kilocalories per day, and the iron is 10 mg. We require more iron for a growing child. Our protein is around 19 gram, and calcium is around 1 gram per day. And food, now we have increased from 600 to 800 ml. It's around 1.5 bottle, more than 1.5 bottle. The child can have water, soups. Vegetable is around a cup per day. We were giving 3/4 cup for the smaller child. Now we have increased to cup per day. Same fruit is also cup a day. And the starch rich, like potato, rice and pastas, whole wheat bread and all, you can give 2/3 cup of uncooked. This is a measurement in uncooked of. Milk she can give around 350 ml, that is 1/3 glass in a day. And meat she can give 1 medium to large piece per day. Egg she can give 2 to 3 eggs per week. And fish she can give 1 medium piece twice a week. Okay. Then what oil she can use is around 6 tablespoons per day. And how we discussed previously, the sugar should around 2.5 tablespoons per day. That is the maximum what she can give. For 7 to 9 years, she requires more energy, because now the child is very active. So she requires around 1600 kilocalorie per day of the energy.
School going age.
School going age, yes. The iron requirement is 10 mg per day, protein is 34 gram per day, and calcium is 1 gram per day. Normally school going children will come and they'll complain, Mama, I'm having a leg pain, I'm having body pain, please press my leg in the night. This is very common we are seeing in our OPDs. This is because of calcium deficiency. Child is not having calcium sufficient diet. Child is running a lot, child is having a lot of physical activity, but calcium is not at par. This is the main reason. So if she gets adequate calcium in her diet, then there's no requirement of supplementing us with the calcium. So, beverages she can take around 900, 1 liter the child should have in a day, 1 liter of water, soups and everything. Vegetable is 1 cup in a day, fruit also 1 cup in a day, and potato also 3/4 to 1 cup in a day. She can take potato, starch and all to keep the child should not feel hungry. See, the main purpose for us of giving of the wheat, pasta, potato is the child should not feel hungry. Child tummy should be full. This will make the child tummy full. When we give protein and all, this is digested very easily. Child may feel hungry every 2 to 3 hours. So proteins are very good, but this is not good for keeping your child tummy full. For that you have to give some potatoes, some starches. For growing child, normally for adult we tell avoid potato, but no, for growing child they require more of calories for growing body. So they should grow well, their weight should be proper, their height should be proper. So do not restrict them for these things. Then milk they can take 2 glasses a day, maybe morning one time and evening one time. If your child is having too much cough with some mothers complain, my child is having cough after having milk, you can give in the evening time. Do not prefer night time, because night time when the child is having anything with the fat, this again will trigger the cough. The child will again have nighttime cough. So then you can tell in the evening snacks you can give 1 glass of milk along with some fruits. So that will be better. when we are giving milk for the child, that time iron should not be given. Iron and milk do not go together. This will reduce absorption of iron. So we tell to the mother, give 1 hour gap of iron with the calcium, like that is a milk. You should be there 1 hour gap. Suppose you are giving iron rich food, you are giving meat in the daytime. So you give a gap of 1 hour to 2 hours before giving a milk. Okay. Night time, what we normally give, we are giving food at 8 o'clock, we are given fish or rice or meat. And 9 o'clock or 8:30 we are given milk because it's bedtime. This is not okay. Give 1 hour gap between them.
So we should not cooperate the iron-rich food along with the milk.
Yes. Iron should be given with vitamin C. It helps in absorption, that citrus food, but not with the calcium food. Okay. And meat, he can take 1 medium to large piece per day. Eggs 2 to 3 times in a week, and fish around 1 large piece twice in a week. He can take. Oil, around oil, butter, ghee, it should be 6 teaspoons per day. And the sugar, what we discussed, it should be 3 tablespoons per day maximum. This is the maximum. It's not he has to take in a day. It's a maximum what he is allowed to be taken in a day. Finally, coming to 10 to 12 years of our child, when now the child is now almost in a pre-teen age, he requires more calorie. Now they will have some body dysmorphism. I'm getting fat. But you have to tell them, no, the calorie should be adequate for his body function to happen. So it should be around 2000 kilocalories the child should have. Iron requirement is around 8 mg per day. Protein is around 34 gram per day. And calcium is 1.3. He requires a lot of calcium for his growing bones. Beverages is around 1 liter. Per day he should take 1 liter of water. That the mother should be fixed. Like in the school you should have half liter. After coming he should have half liter. He can take more. There's no restriction, but this is the minimum value. Then vegetables is around 1.5 cup a day. Fruits is 1.5 cup a day. Potato, rice, and it's also 1.5 cup a day. So minimum he should take this much food. Milk is around 2.5 glasses per day. Then meat is around 1 large piece, 1 to 2 large pieces. 1 large and 1 small piece he can take in a day. Eggs is around 3 to 4 times in a week. Fish is around 2 large pieces per week, or 2 times a week. Oils is maximum 7 tablespoons in a day. And as we discussed, the sugar should be restricted around 3.5 tablespoons in a day. That is the maximum a child can take. Okay. And there are many food faddisms now are coming. You should go for intermittent dieting. That is wrong for the kid. Child should not diet. Child should have lot of nutrition. Instead of dieting, you should see what food you're taking should be rich in food. The quality should be important. Second, they should have more of exercise. If you want to reduce a weight, first of all, we do not recommend reduce a weight of 5 kg in a month. They should reduce slowly. Start first with the walking, slow walking, then go for the cycling. These things should be incorporated. Do not diet. The crash diet is always bad for the kids, because if they're suddenly going for a crash diet, their nutrition is going down. They may go for anemia. BP may go down because they're not taking enough water. Child may suddenly they tell I'm having dizziness. Child may fall down suddenly. So please do not anytime encourage. The child will tell, no, I have read on internet, I have seen the results are very good. This is not for kids. This is not for growing child. Their nutrition value will come down. The child will have deficient. Then they'll come with the leg pains or fractures they may have because they're not taking any much protein. The bones are not strong. Calcium is not there. Then suddenly it's trivial injury. Child is just fallen from a stair. Child may end up with a fracture. So we want to avoid that. So always tell your kids, always this is the advice what I give to mother, that you have to give nutritious diet. Do not encourage any fasting for the kids, unless like for the weight loss especially. The child should not fast for the weight loss. Child should have good diet for the weight.
So we understand child should play more.
Yes, playtime should be more. Yes,
no restriction.
He can cut down the sugar part, but do not cut down on the vegetable. Do not cut down the potato starches thing. He should have this for his calorie. He should not cut down in the calorie part.
So, doctor, you have described everything in very much detail. Any advice from your side for the parents on the diet of the children?
Yes. My advice is, one, do not force the child. There should not be any force feeding. We do not want the child to have any negative association with the food. The child should be happy, oh, my meal time has come. He should not feel, oh, my meal time has come, I should run away, or the crying part should not happen. We should be happy, parents should be happy, and the child should be happy. Second, give the child more quality and nutritious food. We are not bothered about the quantity, we are about the quality of the food. Child may take maybe 1 chapati a day, that's fine, but the quality should be fine. Instead of giving snacks, instead of giving chips, instead of giving ice cream, focus more on the quality of the child. Third, good child means good happy child. There are many nutritious deficiencies the child may have. There may be vitamin deficiency, mineral deficiency. This may present to you as an irritable child, not taking food, not growing well. This is just because of the diet. If the child is having healthy diet, these things will be 90% incurred. There may not be requirement of medicines for that. Fourth is, set an example. You are telling, I want an ice cream, but for child you are telling, no, you are not supposed to have an ice cream, you are supposed to have broccoli. This is not good. Have with him the food what you are having. The child will set example. Oh, my mother is having, I should also have the same food. 5, do not compare. This is the most common mistake what as a parents we make. Do not compare for the child. My child is 15 kg, that child is 18 kg. My child is having half chapati, that child is having 1 chapati. All children have their own capacity. Till your child is healthy, your child is growing well, do not compare any time. Finally, make the meal time a fun time. You should also be happy. My child is having a meal. It should be like a fun time with the family. It should not be just you are giving an iPad to a child, you have the food, I will have later. It should be we all as a family are having food together, maybe once in a day. It may not be possible every time because we are working parents.
Yes.
So at least once in a day, maybe dinner time or lunch time, whichever suitable. One time should be a family time. The child should be looking around. Oh, my family time is coming. I should have the meal together. That's my advice. What I can give to the parents and the listeners who are here with me today.
Okay, doctor. Thank you. Thank you very much for being with us in your busy schedule and spending a lot of time with us and giving us a lot of valuable information. Thank you once again.
It was my pleasure to be here. Thank you.
So viewers, I hope this was very useful and informative. See you all in yet another episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle. Till then, this is Jessila Mujib signing off. Good night.
The 16th branch of MegaMart and MacroMart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. MegaMart and MacroMart, your favorite shopping destination.